This is part 1 of the extra and intraoral examination. This will be focusing on the extraoral. You will refer to your clinic manual pages for the exact written protocol. Some items may be done slightly different in the video.
Observe patient during reception and seating and make overall appraisal. Inform the patient of the procedure and rationale prior to the examination.
How are you doing, Ms. Mitchell?
Fine, thank you. And yourself?
Doing great. We're going to be looking on the outside of your face and inside your mouth for anything that is your normal or abnormal normal. And I'll be making notes inside the computer. And so if you have any questions, you just let me know.
Okay, I will.
With this, approach exam with confident attitude. Give clear instructions to the patient and provide adequate explanations. For the extraoral exam, seat the patient upright and raise the dental chair so that you and the patient are at eye level.
Spin you a little bit.
You will observe and palpate the following when appropriate to differentiate normal, no significant finding, from atypical, abnormal, or possible pathological and document appropriately. First, you will do the overall evaluation of the face, head, and neck, including skin.
Notice that he used the antibacterial hand gel because he has passed the hand wash competency.
At some point.
So standing near the patient, visually observe symmetry and coloration of face and neck.
Ms. Mitchell, do you mind removing your glasses for me?
Sure.
Thank you so much. I appreciate it. Just take a look right here. So I'm visually looking at her face, making sure there's nothing drooping, making sure there's nothing that's sticking out or anything like that.
Next is the parietal and occipital regions, including scalp, hair, and occipital nodes. Standing near the patient, visually inspect the entire scalp by moving the hair, especially around the hairline, starting from around one ear and proceeding to the other ear. Standing behind the patient, have the patient bend the head forward and bilaterally palpate the occipital nodes on each side of the base of the head.
So I'm going to move her hairline. Looking for any moles. I notice that she does have some moles on the side of her face. Have you lean forward just a little bit? Thank you so much. Again, moles on the side of the face. So much the other side. Then I'm going to have her lean her head forward. I'm going to feel in the occipital nodes. Drag. Drag. I'm not lifting my fingers at all.
Next is temporal and auricular regions, including scalp, auricular nodes, and ears. Standing near the patient, visually inspect and bilaterally palpate the external ear as well as the scalp, face, and auricular nodes around each ear.
So feel each ear. I'm doing both sides at the same time. Feeling for any bumps. Because if you have two of something, you need to feel them together. Then I'm going to feel the outside scalp. Again, notice I did not lift my fingers at all.
Next is the frontal region, including forehead and frontal sinuses. Standing near the patient, visually inspect and bilaterally palpate the forehead, including the frontal sinuses.
I'm going to have you lean your head back for me. Thank you so much.
Next is the orbital region, including the eyes. Standing near the patient, visually inspect the eyes and their movements and responses to light and action.
Have you look at my finger and just follow my finger.
Nasal region, including the nose. Standing near the patient, visually inspect and bilaterally palpate the external nose, starting at the root bridge of the nose and proceeding to its apex tip. Infraorbital region and zygomatic regions, including the muscles of the facial expression, facial nodes, maxillary sinuses, and temporomandibular joints. Standing near the patient, visually inspect the inferior of the orbits, noting the muscles of facial expression. Visually inspect and bilaterally palpate each side of the face and the facial nodes, moving from infraorbital region to the labial commissure and then to the surface of the mandible. Visually inspect and bilaterally palpate the maxillary sinuses. To access the temporomandibular joint, gently place a finger into the outer portion of the external acoustus meatus. Ask the patient to open and close the mouth several times, then move the open jaw left, then right, and then forward. Ask the patient if they experienced any pain or tenderness, then note any sounds made by the joint.
Can you open and close? Open and shift your jaw left to right. Excellent. And close. Thank you so much. Actually, it feels pretty good.
Buccal region, including the masseter muscle and parotid salivary glands. Standing near the patient on each side, visually inspect and bilaterally palpate the masseter muscle and parotid gland by starting in front of each ear and moving to the cheek area and down to the angle of the mandible. Place the fingers of each hand over the masseter muscle and ask the patient to clench the teeth together several times.
Can you clench for me? And then relax and clench.
Mental region, including the chin. Standing near the patient on each side, visually inspect and bilaterally palpate the chin. Anterior and posterior cervical triangles, including sternocleidomastoid muscle and associated nodes. With the patient looking straight ahead, manually palpate with 2 hands on each side of the neck to assess the superficial cervical nodes. Start inferior to the ear and continue the whole length of the sternocleidomastoid muscle surface to the clavicles. Then have the patient bring their head slightly forward away from the headrest, turn their head to the side and dip their chin, then palpate the deep cervical nodes on the underside of the anterior and posterior aspects of the sternocleidomastoid muscle. Repeat for the other side. Then have the patient raise the shoulders up and forward to palpate over the trapezius muscle surface the inferior deep cervical, accessory, and supraclavicle nodes.
All right. I'm going to have you look away from me, and if you can tilt your chin down to your chest, that's amazing. And then look straight back forward. So what I'm doing is I'm going to hold here so that when she turns back forward, this muscle will pop into my fingers. So go ahead and lean forward. So now I've got a hold of her muscle, and I'm using one side as a rock and one side as a mover. So I'm going to rock, move down, got a solidness, move.
So you're squeezing that muscle in between your 2 hands.
And then I'm going to go back up and feel along her triangles. And I'm going to do the same to the other side, so I'll have you look away and then look back forward again. And I'm going to feel her triangles. And then I'll have you look forward. I'll have you shrug your shoulders up, and I'm going to feel inside her trapezius down to her clavicle. This is also a part where you may want to warn them that you're going to go under their shirt, because you're going to go under and you're going to feel along their clavicle and let them know. Okay.
Submandibular and submental triangle, including submandibular and sublingual salivary glands and associated nodes. Standing near the patient on each side, have the patient lower chin and manually palpate submandibular and sublingual glands as well as associated nodes directly underneath the chin and on the inferior border of the mandible. Then push the tissue in the area over the bony inferior border of the mandible on each side where it is grasped and rolled.
Okay. So you tilt your chin down for me. So I'm going to feel underneath here, and I'm going to roll up. Feel, and then I'm roll up. It makes them look super special.
Anterior midline cervical region, including hyoid bone, thyroid cartilage, and gland. Standing near the patient, place one hand on each side of the trachea. Then gently displace the thyroid gland tissue to the other side of the neck while the other hand manually palpates the displaced glandular tissue. Then compare the location of the two lobes of the thyroid using visual inspection and bimanual or manual palpation. Ask the patient to swallow to check for mobility of the gland by visually inspecting it while it moves superiorly and then back inferiorly. If necessary, palpate while the patient swallows. Patient may need water to swallow. Then palpate larynx and deliberately move it.
So I'm going to move her thyroid cartilage side to side. I kind of feel on it. I'm going to again do the rock and the mover. So I have a rock and I do the mover on one side. And then I go back up and do the other side. And then if you could swallow for me. So I have a hold of the side, not very tight. It's just feeling the muscle, and then you can feel it go up and down.
This concludes the extraoral examination.